Welcome, welcome, welcome. Thank you all so much for coming out tonight. Hi, Dr. Johnson.
Hi, how are you? Hi, how are you,
Thank you.
Shaneeta?
Thank you so much for agreeing to do this IG Live with us today. It's a pleasure and an honor to meet you. Just to introduce this session, this is episode number 7 of our Diverse Perspective series, where we just have candid conversations with female surgeons meant to inspire those looking for mentors, those looking for encouragement, those who have questions that, are really difficult to get answered. So thank you so much, Dr. Johnson, for coming out tonight. I know it's going to be an amazing session, and we look forward to just hearing from you and hearing more about you. So to dive into our first question, I'd like to start off by just asking you to share a bit of your journey with us.
Yeah, so I'm a professor of surgery at Morehouse School of Medicine, but how did I get there? I was born in the Bahamas and went to school there and came over for college. And I knew that I wanted to be a doctor really early. I know most people know pretty early that they want to do medicine, but the path to medicine, I didn't know how to get there. I didn't have anyone in my family that was a physician, and so I utilized a lot of mentorship along the way, asking a lot of advice, and went through undergrad at Hopkins, and then I went to medical school at Loma Linda. I did my general surgery training with great mentors at Howard, and then my fellowship is minimally invasive and bariatric surgery, again with wonderful mentors at the Cleveland Clinic. And I'm now the general surgery program director at Morehouse School of Medicine.
Yeah, your voice is a bit low.
Okay,
Okay, that's better. Yeah.
good.
So I'm sorry. I think could you just repeat the last part after Hopkins? I think that's the last.
Yeah. So I did my undergrad at Hopkins. I did my medical school in California at Loma Linda. I studied my general surgery residency at Howard with wonderful mentors. And then I did my fellowship, which is in minimally invasive and bariatric surgery at the Cleveland Clinic. And I'm now at Morehouse School of Medicine in Atlanta, where I'm the program director.
Awesome. It's very inspiring that you came from the Caribbean, that you had no one to really guide you and that you found mentors and you just, kept on going till you were successful. That's amazing. um, okay, so our next question. In your opinion, why is it important to have a diverse team of residents in the residency program?
Diversity really brings strength to any program, any organization, any institution. So the more diverse you are as an organization, the more breadth of ideas are brought to the table. You bring so many differences that it's really, really important, not just for the patients we serve, but for ourselves as well, so that we broaden as human beings and we learn more. We have a very diverse group at Morehouse. I love spending time with them. There's so many different points of view and perspectives that are shown, and they bring so many ideas and initiatives to the table, and we're very receptive to that because we as a program want to grow and expand as well.
Right. Right. The very good points. So the next question, in terms of diversity, inclusion, and equity in surgical residency, I mean, over the years, from being a resident to now being a program director during fellowship, what changes have you seen, both positive and negative?
So you may have noticed that or seen some of the articles that show that we really haven't had a lot of change in diversity from the 1970s until now. And that's really unfortunate.
Mhm.
We are trying to make changes, but in order to affect the number of diverse surgical residents that we have in a program or across the nation, we really have to start way back. We have to start with our kids that are in elementary school,
Yeah.
letting them see themselves being represented so that they know that this is a possibility for them. I was reading books by Ben Carson as a child, and that let me know I was interested in surgery and wanted to pursue that. So we have to give exposure very, very early.
Yes.
And we have to also nurture that. So, mentorship and advisors and support around the way, groups for folks that are interested in science and education and so on is so important. And that's the only way we're going to move the needle. So, unfortunately, I wish I could say that the needle has moved, but it hasn't moved. You know, we know that the numbers of minority physicians are very low in the United States still.
Yeah.
So, we have about 13% African Americans in the United States, but only 5% of physicians are African Americans. And the other minority populations are very similar. So we have a long ways to go in order to represent accurately our population within the medical field.
That is so true. Do you envision do you envision any improvement in the future with all these pipeline programs that we have in place right now?
So I'm very optimistic and hopeful that this renewed, or I'm not sure if it's renewed, this new focus that we have on diversity, equity, and inclusion is going to cause us to have results down the line. I don't expect the results to be that significant early on, but let's say 15 years down the line, we should see a really big difference. And I like that programs are being intentional in the way that they pursue diversity, equity, and inclusion.
Can you expound more on the ways in which programs intentionally do that?
Yeah. So a lot of programs are putting in place programs for diverse students to be exposed to their institution or to have experiences. Visiting student opportunities are available, especially for diverse or minority students.
Right.
And that is all to make sure that they improve their chances of having a diverse residency program or medical student body. And that's really important. You know, as we look at DEI, we need to make sure that DEI is real. So we don't want window dressing.
Yes.
We want real initiatives that are
Yes.
going to show some real results. And you know that when you're on the ground at the institution, you can tell if this is the culture or this is just what's being said. You know, when you look around the walls of the institution, do you see yourself represented? Are you represented on the faculty as you look at the faculty members? When you go to interview for the residency program, do you see yourself there? Or is there no one like you? And
Right.
all of these are things that the institutions have to grapple with, and they have to take a hard look at themselves and see if they are accurately representing the population that they serve and also the population that they should be serving.
That is true. I know that you can only speak for yourself, but one thing that I do wonder sometimes is that yes, we have all these programs in place to give minority students more exposure, but at the end of the day, it really comes down to the program deciding to have those students become residents in their program. Um, in your opinion, across the board, how is the mindset of residents or program directors geared as just being diverse and open to having any having minorities on their program? Do you still see a lot of bias in terms of the residents that they choose?
I would say historically, surgery has really not been a very diverse field. I do think that the diversity is improving.
Okay.
You know, we're seeing a lot more women in leadership positions. We're seeing a lot more underrepresented minorities in leadership positions and on the faculty of institutions. So it is changing. We now have two Black female chairs of surgery in the country. That's the first ever. So things are starting to change, and I think that's happening because people are more awake and realize more that this is important and this is not going to happen by happenstance. It has to be intentional.
That's true. And it really helps having people like you in these positions because, like everyone says, you have to be in the room for you to change it. And just you being in that position, you can advocate for minorities. So
I think
my
we
next
all have to advocate. We have to advocate for diversity. All of us, we can all do that. We are all leaders in making a change. So we all have to take that hat on.
I'm sorry, you froze for a second.
Oh, I said we all have to take that role on. It's important for everyone to do their part. So we're all leaders in some way, and people are looking up to us in some way. So use that power position to make a difference.
That is true. That is very true. Okay, so my next question, how do you as a program director promote diversity, inclusion, and equity in your program?
We have a lot of programs within our department that are focused on DEI. We have a diversity in surgery lecture series where we bring diverse surgeons from around the country and internationally. We have had surgeons from the Bahamas and Barbados speak at our program, and that helps us as well. That helps us broaden our horizons and expand our collaborations. So we have programs in Africa that we are collaborating with, programs in the Caribbean. We do a lot of outreach within the city of Atlanta as well.
Nice.
So we are very, very focused on DEI.
Very nice. And I love that you are promoting having residents who look like the population of patients that they serve.
Not only that, I promote that my residents are big advocates. So you'll find that a lot of our residents are out there advocating for their patients, for the best care for their patients, whether that means socioeconomic means, other types of ways that they're advocating for their patients. They're involved in health equity. We've gone to the capital of Georgia and advocated for our patients. So that's important to me too, that they realize the strength they have in their voice and they use it.
Yes, I love that. Okay, so my next question, what challenges or setbacks have you experienced in implementing these initiatives?
Yeah, you wish everything would be like a magic wand, but it's not. There are finances that are involved. There's red tape that may be involved. And so those are things that can slow down initiatives. I don't say cancel. There's got to be a way for it to happen. So you may encounter some obstacles that mean you need to make a turn or two in order to make it happen. And so you do. So for instance, our collaboration with the American College of Surgeons and the University of Zambia has been pushed back by a couple of years because of COVID. Nobody saw a global pandemic happening, but we're still moving forward. We've still started what we could. So joint journal clubs have started, trauma research have started, quality initiatives have started despite that.
Is there any way that you communicate the things that you are doing and the initiatives that you are implementing with other programs who are looking for ways to implement diversity and inclusion in their programs?
Yeah, so interestingly enough, the program directors in surgery are all pretty well connected. We communicate very well. And so a lot of our initiatives we will share with other program directors around the country. And that helps us to put into place initiatives that are working well for another program, then we can utilize that for ours as well. And so there's a lot of back and forth communication between the program directors.
Nice. I perceive that things are going to get a lot better in the upcoming years.
I think so too. I think we're on our way. And the more that you guys stand up and, start doing this so early in your career, it's really admirable, and I think it's going to make a big difference.
I hope so. Yeah, so my next question, so if you had the power to implement nationwide changes to the nature of surgical training in the US as far as diversity, inclusion, and equity are concerned, what changes would you make?
Actually, some of those are already being implemented. So one is getting rid of the scoring on step one. That proved to be quite a barrier for diversity. And so now that is being removed, I think we will see an increase in diversity in programs. We also have a problem with adverse actions with residents. Studies have shown that minority students have a higher chance of adverse actions, including to dismissal and non-renewal of contracts that is out of proportion
Mhm.
to the other populations. And so we really need to work on that as well, and making sure that we address the reasons behind that, whether it's implicit bias, microaggressions, and other things. So we need probably nationwide standardized curriculums in microaggressions, unconscious bias,
Yeah.
and other things that play a role into your selection into the residency and also your success in that program.
Yes, definitely. That's very true. 'Cause it's not just about getting into the program. It's about, getting in and doing well and becoming a very good surgeon.
Exactly.
So kind of to piggyback off of that, um, what initiatives do you implement or do you know of that help to just train residents, attendings, all employees in terms of microaggressions and just treating everyone fairly and equally?
Mhm. So we've implemented at the medical school, we've implemented training on implicit bias for everyone. And then in our department, we have done targeted workshops on microaggressions and
Mhm.
anti-bullying and anti-racism and other wellness topics as well. So we've been very, very deliberate in the way that we've approached these topics, and very open. You'll find that they're very frank discussions that we have, because we've all encountered some microaggression or some unconscious bias along the way, and it
Yeah.
impacts you. And if you haven't encountered, which I doubt, but you have, but if you haven't encountered, you've probably seen somebody who's encountered one, and that impacts you as well as an upstander, or by it used to be called bystander, but now it's an upstander.
Yeah.
How do you address that as well to diffuse the situation and to provide some sort of wellness there?
And another thing that I've seen is, that when hospitals try to have these programs, these initiatives, a lot of the time people don't take them like seriously or get invested in them. What do you do, or what would you recommend doing to get people more involved and get them more interested and invested in these initiatives?
That's very true. And this is what we're talking about, the window dressing, right?
Hmm.
We don't want window dressing or just lip service. We need these to be initiatives that are taken seriously. And people tend to follow the leadership. So if the
Hmm.
leadership is taking it very seriously, and that is the culture of the organization, then you'll find that the students, faculty, employees will take it seriously too. And
Right.
so I would look at the leadership and see how genuine the leadership is about these initiatives.
Right. So it needs to be a cultural change. The culture of the program of the hospital needs to change.
And that's very hard, right? Changing a
Hmm.
culture is extremely hard and very, very slow.
Yeah.
But, things like what we've experienced in the last couple of years that have really shown racism in the country help
Mhm.
to move the needle and move things forward. And we have to make sure that we don't let that fall by the wayside, that we continue, because it's very important, not just for your generation, but the generations behind you, that we provide opportunities for diverse surgeons as well.
Yes, very true. Very, very true. Okay, and so my next question, what advice do you have for medical students who are assessing their residency program in term commitments in terms of diversity, inclusion, and equity?
That was a lot easier when you were able to come in person. But you can
Yeah.
still get an idea. You can look online, you can ask around, look on the website and see. But see if you see yourself represented. If you're able to take a visit, look at the walls and see whose pictures are on the walls. Is there any? Look at the residents, look at the medical students, see how diverse the student population is, and then ask the tough questions. Ask, the chair of the department, the program director, what are their initiatives around DEI? What is their interest in increasing their diversity? And if they are interested, what do they plan to do about it in the next 2 years, 3 years, 5 years? But you'll get a good idea by seeing if you can see yourself there. You know, if you look at the walls and you're not represented, then it seems like they may have a ways to go with getting diversity, equity, and inclusion at that particular program.
Yes. And so, what is your advice for, getting into programs where they don't seem to be about diversity, inclusion, and equity? Like
Mhm.
suppose, a medical student applies and they get into one of those programs. Like, what advice would you have for that student, just, for still succeeding and doing well in that program?
Mhm. You want to now look for mentorship.
Mm-hmm.
And even if you're in a diverse program, you need to look for mentorship as you're going through your training. But even more so, if you are in a program without a lot of diversity, look for people that are going to be in your corner. You're going to need people that you can talk through things that happen. I promise you, surgery residency, you're going to have some issues that come up that you want to discuss with somebody. That's just the way it is. It's 5 to 7 years of training, and you spend a lot of time in the hospital, and it's a difficult job. It is. So you need somebody in your corner that you can speak to. And there are a lot of organizations like this organization where you have mentors.
Yes.
Really utilize those mentors, speak to them often. And I lead the mentorship program for the American College of Surgeons. I tell them, make sure that you take the time to develop that mentorship relationship. So you make appointments with your mentor, you show up on time, you have things that you want to discuss, you follow up on what you discussed the last time. Really utilize your time very well. And that as well, they can, but if you in that residency program, if you don't see yourself
I'm sorry,
represented
you
in,
froze for a few minutes.
you did too. If you don't see yourself represented in that program, all is not lost, because I promise you there are so many mentors out there. You just have to reach out to them. So reach out to them through this program, the Association of Women Surgeons, and there are many, many more organizations that you can be a part of, and get that support that you need. People have done it before.
Mm, that is true. That is true. I really want to ask, when you were a surgical resident, how diverse was your program at the time?
Very diverse. So I went to Howard,
Mm-hmm.
and when I went to Howard, I had never encountered female surgeons. And so my program director is an amazing surgeon, Dr. Deborah Ford, who is now dean at Howard University College of Medicine. But just amazing mentors and advisors there. So it really helped me as a female surgeon to really grow and to become a resilient surgeon, one that knows where they're going, how to get there, and knows also that they have the backing of other more experienced surgeons as they go along their path. And so I cannot say enough about that program.
Nice. And I know I'm asking a lot of extra questions, but as they come, I'm just asking. Even as a third year medical student right now, um, what advice do you have for me in terms of mentoring those who are coming up after me?
Mhm. So you have a lot of information for those. You probably haven't sat down and thought about how much information you've amassed over these past few years, but you have a
Mm-hmm.
lot of information. How you got into medical school, how you made it through these difficult courses, how you decided on surgery as your field. All of this is really, really important and can be helpful to someone coming along. And I would say we really need to pay it forward. So I think it's never too early to be a mentor. So
Yeah.
if someone reaches out to you or you see someone that you can mentor, do so. It's really important. And I think you get it back in karma.
Well, I've been really blessed to have a lot of amazing mentors, and through AWS, I've met many wonderful surgeons who never hesitate to, give advice or extend a listening ear. So I really would love to pay it forward.
Good, good. That's so important. You really can't underestimate that. And it's so rewarding to see that your mentorship may have helped someone in their role and in their career down the line.
Okay. I'm just checking to see if anyone in our audience has any questions. Okay, I don't think I see any. So my final question, just in general, some nuggets, some highlights from our talk. Um, Top three pearls for just, medical students coming from backgrounds underrepresented in medicine and just kind of navigating in this world of surgery.
You can never ask too many questions. There are no stupid questions. The more advice that you can get, the better. So, really utilize whatever resources you have very well. That's really, really important. Give yourself a break. Sometimes we are so tunnel visioned, and that's why we're in medicine. We got there
Yeah.
because we are very, very serious people about what we want to do. But sometimes you need to give yourself a break. Make sure you're practicing. I don't think we've done that enough as we go through medical school and residency. Make sure that you're doing that. And then start early with your associations and organizations like you guys are here in the Women's Surgeons Group. Very, very important. That gives you collaborations and a network and advice, and it helps to really jumpstart and progress your career very quickly. So make sure you utilize that.
Thank you, especially for the second point, giving yourself time. I think that's something we all forget to do. So thank you
Unfortunately.
so much for that. And thank you so much for this talk. I think we covered a lot of very important topics. And I think everyone who was listening really got something out of this conversation. So thank you so much, and thank you so much for just all the mentorship that you do for paving the way forward, and just for giving girls like me and all the other students out there someone to look up to, someone to work towards being. It's always nice having an inspiration. It's always nice, just seeing your end goal. So thank you so much.
My pleasure. Someone did it for me, so it's my pleasure to do it for you. And if there are any questions that we didn't answer, you can feel free to DM me.
Okay.
All right.
Thank you so much. Have a good evening.
You too. Bye bye.
Bye bye.